When you first heard of metastatic breast cancer years ago, what were the one or two words that came to mind?
I would say fear and death.
When I think of young women and breast cancer, I think of a disconnect between young women and metastatic breast cancer, and also fear.
I actually think about stigma and isolation.
I guess before my own metastatic diagnosis years ago, when I didn't even know what metastatic breast cancer was, I would say the one or two words that came to mind would be death and in some ways loneliness, like a small group, an isolated group.
So now, years later, what would you say the one or two words that first come to your mind when you hear metastatic breast cancer in young women? Are they the same? Are they different? What comes to mind?
I think for me it's different. I've been working in the breast cancer field for about 6 years now, and now when I hear metastatic breast cancer, I think more of hope and living, because these young women have a lot of living to do.
I've been working in the breast cancer field. I started about 15 years ago, and I moved on to the nonprofit field and then returned. So there's been a time lapse for me personally and professionally. And I think hopeful is a good word to use, but there still is a disconnect. And we know young women are still isolated.
Yeah, I think that I would also say that there is a significant disconnect, and there is definitely more reason to be hopeful. There's a lot of focus on long-term side effects and what the impact of living with a disease is, which is very different than it was 15 years ago. But I think there's still a significant sense of isolation as a young person living with a metastatic diagnosis.
So I've been working in the breast cancer field for about 14 years when Sharsheret was first founded, and I've been living with metastatic breast cancer for 5.5 years or so. I would say the one or two words that come to my mind now would be options. I think there are more options for women living with metastatic breast cancer. And although I do think isolation is still a valid feeling, more of a sense of a sort of social media community that is definitely building for young women living with metastatic disease.